All right, let's dive into one of the trickiest communication stations you'll come across in your clinical exams, suspected laryngeal cancer.
Welcome to this clinical walkthrough on the suspected laryngeal cancer case for UKMLA, brought to you by Mediate, your 24/7 practice partner. We're going to break down exactly how you can approach this consultation with confidence and nail it.
So here's our game plan. We'll walk through this in 5 clear steps, starting with the initial encounter, then digging into a focused history, tackling how to deliver difficult news, laying out the management plan, and finally, making sure you safety net properly before you close.
First things first, the initial encounter. Your whole goal here is to come across as professional and welcoming, to set a calm, confident tone from the get-go. Here's a perfect script to start with. It's polite, it's efficient, and it gets the ball rolling. Just say, "Hello, I'm one of the doctors here at the practice. Could I confirm your full name and age, please? And what brings you in today?" It's a simple opening that really builds a solid foundation.
Okay, now we move into the detective work, gathering all the information. This is where you'll use a structured approach to find those critical details. We're going to use the OD-PARA framework and screen for all the important clues. Let's apply OD-PARA to the patient's hoarseness. That stands for onset, duration, intensity, progression, things that make it better or worse, and any other associated symptoms. You need to ask about every single one of these, from when it started to if it hurts to talk. Using a structure like this means you won't miss a thing.
After you've got the story of the main complaint, you have to ask about red flags, and I mean ask directly. Have you had any neck pain or a lump? Any trouble swallowing? What about earache? Have you lost any weight without trying? And have you been coughing up any blood? The answers here are absolutely crucial. Next up, you've got to screen for 2 huge risk factors. For smoking, ask clearly, do you smoke? And if you do, how many a day and for how long? For work, ask, what kind of work do you do? In a case like this, finding a 35-year smoking history and that they're a mechanic exposed to diesel fumes, well, those are major red flags right there. And don't forget, we're treating a person here, not just their symptoms. That's why the ICE framework is so important. Ask about their ideas on what's causing it, their concerns about what it might be, and their expectations for the visit. It shows you care about their perspective. So, all that information gathering leads us to the most critical part of this OSCE station, delivering difficult news. You absolutely need a clear, structured approach for this. Just follow these 4 steps. 1. Express your concern. 2. Explain why you're concerned by linking it back to the red flags and risks. 3. State your suspicion clearly. And 4, this is the most important part, pause. Stop talking and just listen. You can start by framing your concern around what they've told you. Something like, "Mr. Patient, I'm a little concerned about what you've described. Your hoarseness has lasted for over 2 weeks, and when that happens, we tend to take it more seriously." This gives them a little warning shot that serious news is coming.
Now, you've got to connect the dots for the patient. You link their personal story to your concern. You could say, your smoking history and your work with diesel fumes are known to increase the risk of problems with the voice box. I'm sorry to tell you this, but one of the possibilities we're concerned about is laryngeal cancer. You have to be direct, but you also have to be empathetic.
And you've got to be ready for their reaction. If they ask point blank, "Is it cancer?" Be honest, but not final. Say, "We're not saying it definitely is, but we want to make sure we're not missing something serious." If they're just scared, validate that. "I completely understand how difficult this is to hear. You've come in at the right time."
Look, this is a tough station, there's no doubt about it, but you can absolutely master it with practice. Remember, you can practice this exact case right now and get objective feedback on mymediate.com. After you've delivered the news, you can't just leave them in silence. You have to immediately pivot to a clear, structured management plan. This gives the patient back a sense of control and shows them there's a path forward.
Your plan needs 3 parts. First, explain the urgent 2-week wait referral to an ENT specialist. Second, tell them what tests they can expect. And third, you can briefly mention that treatments are available, which gives them a bit of hope.
And when you explain the tests, please, no jargon. A nasaldoscopy is just a small camera to look at your voice box. A biopsy is taking a small tissue sample. And a CT scan is to get a better look at the deeper structures. This makes the whole process feel less scary.
Okay, we're in the home stretch now. The final part of the consultation is safety netting and closing.